Chapter 4: Anesthesia. Anesthesia services are services that are reported separately from the procedure. An anesthesiologist is a physician whose sole purpose is to administer and monitor anesthesia and its effects on the patient. Anesthesiologists are often members of outside practices. Anesthesia creates a state of analgesia, which is the absence of pain. This allows the patient to have surgery or a procedure without experiencing pain. The anesthesiologist administers medication that will induce general, regional, local, or conscious sedation in the patient while managing life functions of the unconscious patient and directing respiratory and cardiac resuscitation efforts. Anesthesia may also be administered by a certified registered nurse anesthetist. Types of anesthesia include general anesthesia, which alters the patient's perception and affects the whole body, causing loss of consciousness. Regional anesthesia, which anesthetizes a particular area or region of the body. An example of regional anesthesia is an epidural block. There is also local anesthesia, in which an anesthetic agent is applied topically to the skin or injected subcutaneously. Anesthesia codes represent the professional services of the anesthesiologist. Therefore, the codes are not reported by the hospital, rather they are reported by the anesthesiologist's practice. The billing of anesthesia services may vary depending on the third-party payer and the state in which you are billing from. Anesthesia services are billed according to a standard formula for payment that is generally accepted throughout the United States. The formula is basic units plus time units plus modifying units multiplied by the conversion factor. The Relative Value Guide contains codes for anesthesia services. The purpose of the RVG is to compare the complexity of various anesthesia services so that the relative value for each service may be assigned. The basic unit for a service is this RVG value. Time is measured from the beginning of the preoperative period, when time is spent preparing the patient to receive anesthesia, through the time when the patient ceases to be under the care of the anesthesiologist during the postoperative period. This time is recorded in the patient's record. The amount of time by unit will vary by payer, but is typically in 15 to 30-minute intervals. Modifying units reflect circumstances or conditions that change the environment in which the anesthesia service is provided. Physical status modifiers are an indicator of the level of complexity of the services required to treat the patient. These modifiers are described beginning with a P and ending with a number from 1 through 6. Qualifying circumstances are codes found in the medicine section, but can also be found in the guidelines of the anesthesia section. These codes are treated as add-on codes and must accompany the anesthesia code. They may not be used as a standalone code. Each third-party payer issues a list of conversion factors. The lists vary with geographic location because the cost of practicing medicine varies from one region to another. Once you have all the elements of the formula, the total fee can be calculated. As a reminder, Bundled in the anesthesia services is the preoperative services, beginning when the anesthesiologist prepares the patient for surgery, during the entire procedure, and during the postoperative services, ending when the anesthesiologist leaves the patient. Conscious sedation provides a decreased level of consciousness, but does not actually put the patient to sleep. The patient can breathe without assistance and can respond to stimulation and verbal commands. Nonetheless, a trained observer must be present to assist in monitoring the patient. CPT codes marked with a bullseye identify the procedures involving conscious sedation. And finally, when an anesthesiologist bills for their services, be sure that the charges must match those of the surgeon in order to be paid correctly.